My name is Dave Hollenbach, the host of From Embers to Excellence, a podcast that explores the many facets of leadership from the perspectives of some amazing people. We discuss the triumphs and failures that have shaped our lives and our leadership philosophies. I've found that it isn't whether we fail that defines us, but when we do fail, how we respond. Leaders dust off the ashes and use their failures as fuel to work harder and as lessons to come back wiser and stronger, more resilient, more determined, and more committed to excellence. Today I'm speaking with Dr. Aimee Duffy. She's the #1 best-selling author of Normal Doesn't Have Side Effects. She's an award-winning speaker, having spoken at the Harvard Club of Boston, CNN Center, Nasdaq, the New York City Bar Association, and the Philadelphia College of Physicians. Dr. Duffy has shared the stage with Martha Stewart, Suzanne Somers, Ice-T, and Dr. Oz. She is a frequent podcast guest and expert guest on ABC, NBC, CBS, and Fox Network TV shows. Dr. Duffy is the founder and medical director of Carolina Integrative Medicine in Clemson, South Carolina. I am going to have her website links in the show notes so that after listening, I'm sure you're going to want to dig in a little bit deeper, find out more about her, and also find out where to get her book. So be able to do that on her website, aimeeduffymd.com or carolinaintegrativemedicine.com. Thank you very much, Dr. Aimee, for joining me today and allowing this conversation to happen. I really appreciate it. I know we're going to dig into some really cool stuff. I had the privilege of hearing you speak at the College of Physicians in Philadelphia, and just really awesome getting to hear you speak and getting to hear the other speakers and hear from Dr. Oz, and just what an awesome event. So really, thank you very much for coming on and having this conversation with me.
Absolutely. I'm excited to be here.
I always like to start off where it all began, which is where you were born and raised, and what did your parents do?
That's a busy story. I was born in Chicago, Illinois. And then actually, when I was 5 years old, I skipped kindergarten and my parents got divorced. So I ended up in 3 different schools in first grade. So I went from Chicago to Washington State, where my grandparents lived, and my mom and I lived in the basement there for several months. And then we ended up settling in Denver, Colorado, and ultimately lived in Boulder. So I would say most of my childhood from second grade through college or high school graduation was in Boulder, Colorado. So grew up there. Busy, played lots of sports. Softball kind of became my thing. And then ended up going to Texas Lutheran University in Seguin, Texas, just outside of San Antonio, playing softball there. And what was the second one? Oh, my parents, my mom, originally was a teacher and then struggled a little bit, single parent. I remember her being a janitor at a church, and I used to go help her clean at nighttime before Saturday church or something like that. And then she ended up going back to school and she got her software engineering degree. And so ended up with a great career in computers. It was a great time back then in the 90s for her to get involved in computers. So she is now retired and loving being a grandma of my 4 girls that I have. So life's crazy, but happy, and we get to see her a lot. She still lives in Boulder. I live in South Carolina, but she comes frequently to hang out with us. She's got her own little room in my house. So my dad was a Lutheran minister and missionary. So I spent my second birthday in Brussels, Belgium, but I don't remember it. I know what the pictures look like. I was this little blonde, white-haired, fluffy-headed little girl amongst, African little boys. So it was kind of a funny picture, but that's my memory. So my dad traveled a lot, and he settled down in Houston, Texas, and was a Lutheran pastor there. So I have some great memories of getting to fly on DC-10 jets as an unaccompanied minor. And when I was little, getting to go visit him for holidays, and he lived in Chicago still for a long time. And so Chicago Cubs is one of my great memories. Like, I remember flying on a DC jet plane. There was about 3 or 4 other unaccompanied minors. And once the plane was up in the air, they came and got all of us, and they brought us up into the front where I just remember a big bar. Like, I don't even know if there's planes like this anymore, but there was like a bar area, and there were 4 seats kind of facing each other, very fancy kind of first class. We got to have Cokes and, hang out up at the front part of the plane. And so it was very, very special occasion. So I have great memories of flying to visit my dad. And that was back when the Cubs Wrigley Field didn't have lights, so they would play double header. So my dad and I would just walk. I think he was maybe like 10 or 12 blocks where his house was to where Wrigley Field was. So we used to walk down and just watch the Cubbies play. Mark Grace, number 17. So I've been number 17 for a long time in my softball career, and listening to Harry Carey and all kinds of good stuff there. So we'd watch the double headers, and then he'd say, "You want to come back again tomorrow?" And we'd walk down to the ticket booth and buy our tickets for tomorrow and do it all over again. So I spent many summers in Chicago when I was little. So I have some good memories there. That's kind of me and where I grew up, and ended up in Texas for college. And then my dad was in Houston at the time, and Texas has 10 medical schools as opposed to Colorado's 1. So I became a Texas resident so I could apply to medical school. And I ended up at the University of Texas in San Antonio, Texas. So that's where it all started.
Who influenced you in that trajectory? Why medicine?
I absolutely loved babies when I was little. If there was a baby somewhere, I wanted to hold that baby, squeeze that baby's cheeks. I don't know if you remember Cabbage Patch Kids, but I had all the Cabbage Patch Kids, the bald ones, and I had all the accessories and everything. So I just loved babies. And when I was about 11, we were at a pancake breakfast in our neighborhood, and there was this, looked like the Michelin baby sitting in the sand. And so I just went over there and I started playing with him, and his mom was there. We started chatting, and she said, "He loves you. You love him. Like, why don't you come babysit?" And I said, "Well, I'm only 11. I don't know if I'm allowed to babysit yet." And she said, "Well, just come over and start hanging out, and you can play with him while I'm trying to get some stuff done around the house." So that was my first job. And I grew up with that family basically from 11, through high school. And her sister was having babies at the same time. So I got connected with the whole family, and her sister Deirdre was due to have baby number 2 when I was 17 years old. And they invited me to be in the delivery room with them. So this was Thanksgiving night, my senior year of high school. I got the phone call about 9 o'clock. It was time to go to the hospital. So I'm rushing over there. I have no idea what to expect. I've never been involved with this before. I don't even remember watching deliveries on TV or anything like that. So I didn't really know what to expect, but it took all night long. And baby Joshua was born early that morning. And I just remember when he was put on mom's chest, and I was standing kind of over the side of the bed looking down. I wasn't in the business end of things. I was up at the top. And I just remember sitting there going, "This is the coolest thing I have ever seen in my life. And I want to do this. I want to be a doctor." And so I did it. I went to college. I went to medical school, residency. I picked a residency that was specific to delivering lots of babies. And in that time frame, I have delivered over 1,000 babies in my career, including having 4 of my own, one of which I delivered myself. So we can talk about that story. That's fun. So that was really my inspiration, I would say, is I wanted to deliver babies. And here I am now. I transitioned my practice. So I delivered lots of babies, and a couple things happened. I had babies of my own. So being on call all the time, babies don't show up at, 2 p.m. on a Tuesday on your schedule. So when you have lots of babies at home and a business you're trying to run, it got kind of exhausting and tiring to be on call all the time. So I made a hard decision to close that chapter and move into this functional or integrative medicine. So I think they're somewhat related. You know, I loved delivering babies because it was fun medicine. They wanted to come to the, you know, they wanted to be in the office and they wanted to be at the hospital, and, you know, we weren't delivering bad news. We were having fun times, and, you know, bringing life into the world was awesome. And in that field, when you're not delivering babies, you're doing GYN or lots of women's health. And there was tons of conversations about hormones for women. And that wasn't really part of my training. So I had to really kind of go out and get more training on my own. And during that time, there's something called the Women's Health Initiative, where there was a lot of scary conversations about hormone replacement and the negative aspects, and women were dying. You know, they ended this 7-year study early because they saw such an increased risk of breast cancers and heart attacks and stroke in women in one of the arms of this study. So there was a lot of conversation about it. Should we be on hormones? Should we not be on hormones? And it was very unsettling for both patients and myself as a practitioner. You know, I took an oath back in medical school that I was going to do no harm. And here we are, you know, with these medications we know are causing harm. And I just really was unsettled with that. And I thought there's got to be another way to do this, because these women were suffering. You know, it wasn't a good quality of life. They were, Suzanne Somers calls it the 7 dwarves of menopause. And she says, itchy, bitchy, bloated, you know, not sleeping well. I can't remember all of them. I'm sorry, I wasn't in my brain today. But anyway, it's just kind of funny. You know, women are just kind of unhappy, and they don't want to settle for anything, but yet at the same time they're stuck between a rock and a hard place of having to, you know, decide, do I want to take this medication that could potentially cause me harm, or, you know, have a better quality of life? And so I started doing a lot more research and happened upon bioidentical hormones or natural hormone balancing, and finding, I always say it's kind of like Alice in Wonderland goes through that tiny little hole into this like rainforest of beauty and this world out here that I had no idea existed, where you could find out what the underlying cause is, which is what functional medicine is all about. So in hormones, it's testing what's the imbalance going on, what is that person dealing with, and not just checking off a list of symptoms and saying, oh, take this pill and see if it helps. It's actually looking at, why do you have the symptoms that you have? And then when we replace those hormones, we're using bioidentical natural hormones in the same chemical structure that should be in your body, and just getting you back to what normal levels should be, which is kind of the inspiration for my book, Normal Doesn't Have Side Effects, right? If we're just getting you back to normal, using normal things that are in your body in the first place, and getting it to levels that are going to make you optimal, then we're not having to worry about all the side effects that come with traditional medication. So that's really, you know, the inspiration for transitioning my practice is bringing life into the world. And now I get to restore life to those who felt like it was lost. And that hormone process sort of expanded. Once you start doing that in one aspect of medicine, it's like, well, surely there's got to be another way to do other things. So it goes into gut health and heart health and brain health, and it just expands from there. There's so much to learn. I'm like a sponge. There's all kinds of stuff out there, and it's fabulous.
Really curious about the hormone replacement therapy, and really, I have a daughter that's 15, and we haven't had the discussion yet. But when she gets older, I'm sure, I mean, I probably won't have the conversation with her, but the whole birth control conversation will probably be had with her mother. But
Yeah.
I would like to be informed.
Well, I think there's kind of, you know, there's going to be a spectrum, of course, over the course of life, whether we're talking about males or females, really, but you're asking about your daughter. So the type of hormone therapy that I got involved in was more, you know, changes as women are getting older, you know, in their late 40s into 50s. Menopause on average is, you know, women in their 50s. So as their hormones start going away and they start having some symptoms, and we can get into that, the importance of maintaining some hormones, because they really are beneficial. We're not just dealing with the symptoms, but we're dealing with some prevention things as well: heart health, brain health, breast health. Even there's a lot of scare about hormones and breast cancer, but if you're doing it the right way, it actually can reduce your risk of breast cancer as opposed to increase. And of course, anti-aging, it makes your hair stay in. I mean, how many older women do you see that are frustrated because their hair is thinning, right? The first thing I think of is hormones. And really it helps you age more gracefully. You look at Suzanne Somers, who's like in her 70s, and she looks like she's about 40, right? She's fabulous. So anyway, that's kind of, where my start with hormone therapy began, is more in the later part of life. For what you're describing in younger women, thinking about contraceptive methods, things like that, there really isn't bioidentical hormones to prevent pregnancy, because that's not a natural occurring thing, right? I mean, we kind of created these birth control pills as synthetics, as fake hormones to interrupt the normal cycle. So what birth control pills do basically is keep your body in normal menstrual cycles. Women, are going to fluctuate, and they have hormone changes that make them ovulate. And then if their progesterone level should start to go up, if they get pregnant, it would go way up. If they're not pregnant, progesterone drops, and then they have their cycle. We're getting really technical here, but what birth control pills do basically is kind of suppress the natural hormones and keep it at a steady state all the time. So there's no ovulating happening. So that prevents contraception, because there's no egg coming in. But yet they can still cycle it enough to allow women to have cycles if they want. But sometimes in the medical world, we're using hormones in young girls who are having really difficult periods or something like that. So it's not uncommon for them to go on birth control just because their cycles are becoming dysfunctional. They're missing school or work or things like that. But again, in the functional world, you can kind of dig a little bit deeper. Where is that coming from? There's a lot of studies about diet and gut health and mental health and all kinds of stuff, stress and managing stress, that can help to support cycles a little bit, so we don't have to use synthetic medications to control periods, basically. But in terms of contraception, there is the birth control, which is kind of the gold standard, with using some form of birth control in the form of synthetic hormones. And then of course there's barrier methods and all kinds of stuff. And when we're talking about young kids and teenagers, particularly up to the age of about 26 or 28, they're at really, really high risk for STIs, or sexually transmitted infections. So we're really focused on that barrier method for them, not just from contraception, but from just keeping their body safe. So it really needs to be an individualized conversation. There are some people that are just anti-hormones all the time, and some that are like, in that part of life, maybe for a few years, 5 years, something like that, can we be on those synthetic hormones just to make sure we're not getting pregnant during the time. And this is a whole new conversation. I mean, it can be, where are you with your family and your child? And, do we need to talk about abstinence versus barrier methods versus, other things? So it can really go on and on. It's hard to kind of broaden that topic, but that's the basics there.
One of the things that you said about all the health risks and different health issues that women were experiencing due to hormone replacement or not properly using hormones. What were some of those health issues, and was there any connection to birth control?
It's interesting that the studies were done with a medication called Premarin and Prempro. And those medications were specifically designed for hormone replacement in menopausal women. And Premarin is actually comes from pregnant mare's urine. So it's actually made from horse urine and designed to sort of be replacing estrogen in women, and then the Prem Pro added a progestin, which is a synthetic progesterone. So women have a bioidentical estrogen, bioidentical progesterone, and then they made these synthetics trying to, again, mimic and hit the receptor sites for these hormones in the women's bodies. Birth control pills are a little bit different. They are still synthetic hormones, estrogen, different types of progestins, which is still that synthetic hormone. So it's hitting receptor sites. But I think what's frustrating, and what I see in functional medicine when we really start digging a little bit deeper, is that particularly taking hormones by mouth, there was a great mentor that I had that when I first started learning about bioidentical hormones, he's a funny guy, and he'd get up and he'd say, we were not biologically designed to eat other mammals' gonads. So why would we be putting these hormones in our body, right? Like, why would we be eating these hormones? So physiologically, what happens when you take a pill, right? It's going to go through your gut and your stomach, and it has to go through your liver first. And then your liver has to go, what is this thing? And, is this something that's going to cause us danger, and I need to filter it out and put a bubble around it and protect us? Or is it something that, is going to be okay? And so when you put estrogen, particularly other hormones as well, in a pill and you swallow it, when it goes to your liver, it converts to things that are not necessarily good guys. And so that's really where the concern comes from, is not the hormone itself. And that's the problem, is that there's no way to really test that. You can test the hormone, but there's so many different metabolites out there. And there are some labs in functional medicine that actually test urine metabolites of all these different hormones. So you can see, is there an increased risk? So what's happening is there's these metabolites of the hormones that are the bad guys, and those are hitting, breast cells and like ovary cells, endometrial cells in the uterus, that sort of stuff. So one of the biggest concerns in the hormone replacement world is breast cancer, some form of endometrial cancer. And then there was also strokes. And so another place where estrogen metabolites hit and cause inflammation is in the lining of your vessels, and causing more plaque and causing blood clotting, dysfunction and disruption and things like that. And that's a lot of physiology to go into, but blood clotting and strokes was a big risk in this study, the Women's Health Initiative. So what's a little bit frustrating is that the Women's Health Initiative was a huge study. I mean, I don't even remember the number of women, but it was like hundreds of thousands of women, but it was funded by this Women's Health Initiative, this huge, foundation. And most medical studies are funded by the big pharmaceutical companies, right? That, studies take a lot of time and a lot of money to do. And nobody's really doing studies on birth control to decide whether they are, causing harm or not. So we don't really have great data. We have the idea that could this cause some dysfunction or not, but there's not really any study that could definitively say there is a correlation between birth control use and negative effects, or these effects I was talking about with the hormones in the menopausal women. So that's, again, sort of the same conversation is like, do we use it over a short period of time? And one of the things that I love to talk about in our whole, functional medicine world is we got to get off this like blinders. We're talking just about, birth control and contraception in young women, but if your liver is in a good place and it can handle these things appropriately, then you're going to be in a safer, position to take these medications. So if you're going to make a choice, okay, I need to be on birth control for this period of my life because I don't want to have babies when I'm 18 or 20 or 22 or whatever. We can get on with our careers and go to college and do cool stuff before we're ready to have babies. So if I'm going to make that choice, then let me make sure that I'm doing all the other things that are going to benefit my body so that I don't have that risk, right? So you can do a yearly or even, every 6-month detox to kind of get your liver cleaning. You can make sure that you're eating really good, clean food. We're not being exposed to other chemicals as much as we can in the environment. So you start looking at your home environment, your household cleaners, the food that you're putting into your body. Our world is full of processed foods and chemicals, right? And so, if you can be more conscious about minimizing those chemicals, then your liver is going to be in a better place to be able to withstand that and have some reserve there. So, that's where we start getting deeper, and you're not going to have that conversation in a traditional medical office where they have 7 minutes to say, oh, we'll check your blood pressure, here's your refill on your pill, any problems? Nope. Okay, we'll see you next year, kind of thing. And really be able to have that conversation about what's going on in that bigger picture.
One of the things that I really wanted to hit on was the inflammation aspect of our health. And it seems like, I'm no doctor, but it seems like inflammation causes so many diseases and illnesses and complications. And inflammation can be caused by so many different things. Some of them being hormones that are stress hormones that are released.
Right.
And how do you work with your patients to overcome the inflammation that's really so commonplace in our society?
Yeah. I mean, it's definitely becoming a big talk, and it really is something that is detrimental. And you got to go backwards a little bit and think about what's going on. Our bodies are smart. Their first job is survival, right? And so it's going to do things that it needs to do to protect us. And if let's say you're in just a normal state, everything's fine, and you get an infection of some sort, right? You're going to have all these inflammatory processes going through. Maybe you're back in the caveman days and you ate something, and so your body responds to that. You might get a fever, you might get bowel changes or something like that. All this gunk that we get in sinuses is all inflammatory stuff that your body is working towards fighting whatever that threat might be. So it's a good thing. And then maybe you're running and you sprain your ankle, and it's inflamed because there's a lot of what we call cytokines, inflammatory cytokines, but chemicals that go to that space to say, hey, we've got to send all the healing juju, down to that ankle so that it can heal quickly, because otherwise we're not going to be able to run from the tiger, right? So it's all about survival. And what's happening in this world is that we're not just wandering around in a normal state and then spraining our ankle or everything's great and then we eat something, and we're being bombarded with all of this threat all the time. I'm gonna go back to the chemical thing, right? The food that we're eating is just full of chemicals. And I always talk to my patients about, they say, well, what kind of diet should I be eating? And I'm like, we really do talk about going back to that caveman state and saying, how many steps does it take for you to go grab an apple and eat it? It's one step, right? Or get some nuts or something like that. Maybe it's 2 steps to take the shell off. But when you start getting into things like eating bread, we don't walk out and go pick the weed out of the field and start chewing on it, right? That wheat has to be processed, it has to be dried. Now it's flour. Well, we're still not even taking spoonfuls of flour and eating that. It's got to have another process and multiple things added to it to make something that, like bread or a bagel or something like that. So the number of steps from where that came from to where it's going into our mouth adds extra things that are going to be inflammatory to our body. So food is really a huge foundation in addressing our gut health. So inflammation in the functional medicine world, really the first place to look is the gut. and what we're being exposed to. And then we've got this environment, especially with our pandemic in the last couple of years, but really it's been that way for a long time, that, everybody's got hand sanitizer everywhere, right? This antibacterial hand sanitizer and soaps, and we're drinking chlorine in our water, so we're basically bleaching out our gut, and so we don't have those good protective bacteria that are designed to kind of be that initial barrier that prevents some of these toxins and things from really getting to our cells where they're going to react. So there's a lot of different things going on there, but really addressing the gut. And so I think there's two parts to that question. One is, I love objective information. So testing is one of the most valuable things, and looking at measures of inflammation. So somebody may feel like they're inflamed, but let's actually get a number. What is your number? So one of the tests that we can measure is something called CRP, or C-reactive protein. And it should be less than 2 in most cases. And some people we can see really high if there's some serious stuff going on, but some people may be in just the sort of a 7, 8, 9 range that doesn't look really scary, but there's low level inflammation there and it's causing damage. So knowing what your number is so that you have a goal, and it's a little bit more motivating. It's not just how I feel, but I can see a number on a piece of paper and go, oh, that doesn't look very good. And then having this conversation so we understand what inflammation does. But that's a really nice objective test. And then another test that I really like to do is food sensitivity testing. So knowing what foods may be irritating your body, rather than saying, okay, I'm gonna Google what foods are inflammatory. Very commonly, you're gonna see gluten, dairy, eggs, soy. Those are kind of the most common ones. We might get into nightshades and nuts, and you can go on. And that's what gets overwhelming for people, I think, is that there's so much information out there. It's like, I don't know what to do. Do I follow this list or do I follow that list? And what my patients love more than anything is this test that just gives them their list. Right now, what's going on in your body, this is what your body's reacting to. So let's start eliminating those threats to minimize some of that inflammatory response. And then we can come in from the other side and start building that barrier back again, throwing in supplements that can help to reduce inflammation, to build the lining of the gut back up, get some good probiotics in there, and really start to connect so we can get to the core source of where that inflammation is coming from. And I think that's the downfall of what's happening in traditional medicine is, again, they're kind of blindsided. Oh, you have inflammation. Let's address the end result as opposed to, going to the source of where it's coming from in the first place.
The connection to inflammation and autoimmune disorders.
So that's very similar. So what happens is, there's a couple different analogies, but one analogy I like to use, I have girls, so we don't play a lot of video games, but, I remember going to something like Dave and Buster's, and you have one of those games where you've got a rifle, you've got a gun, and you've got this big screen, and you're supposed to be shooting the bad guys and not shooting the good guys, right? So you got this, red guy that pops up and you got to shoot them, but when the white guy pops up, you're supposed to avoid it. And when you're in this state of sort of excitement, there's lots of lights going around, it's busy, whatever, and it doesn't really matter. But you end up, what do? You just end up kind of shooting everything that comes at you, right? You don't, unless you're really good sniper or something like that from the military, not me, right? I don't know what I'm doing. I'm just out there trying to play this game. So you end up, shooting at everything. And I like that analogy because that's kind of what your body's doing is it starts to get exposed to bacteria or to these chemicals, and that barrier starts to get dissolved. So you don't have the front line there, you don't have the second line there. So now, your protective layer is starting to get exposed to all these things, and it has a hard time recognizing whether that's a good guy or a bad guy. And so it ends up sending the signals to everything. And then you start to see, if you look, really, really closely at the chemical structure, for instance, one of the most common autoimmune diseases that you hear about is rheumatoid arthritis, right? And rheumatoid arthritis is inflammation in the joints. Oftentimes you see, women who have their fingers all kind of cattywampus and swollen joints and things like that. So what's happening is that there is a bacteria that gets through the gut and through the barrier into your body, and your body starts to react to that. And that bacteria looks really similar to the joint space fluid in your joints. And so if your body is in that state where it's like everything's happening all at one time and I got to fight all the bad guys, and then it sees this chemical that's in your joints, and it's like, man, you look just like that guy was fighting over here. I'm going to go after you too, right? And so it starts fighting your own body because it gets confused in this heightened state of stress and heightened state of inflammation, if you want to call it. Its job is to protect you again. So it thinks that your joint fluid is a bad guy. And really, you can take that to any autoimmune disease. So psoriasis, for instance, is a skin thing. So there's another chemical that is similar to the chemical that we see in your skin, that structure. And so your body starts fighting itself, basically. That's what autoimmunity is. So again, traditional medicine is like, oh, well, your immune system is in this heightened state of intensity, and our job is therefore to suppress your immune system and tell it to stop doing that. Well, that works for the acuteness of getting rid of the symptoms. Lots of people have improvement in their symptoms when they go on these autoimmune type medications. However, that's just another chemical. There's a lot of negative side effects that go along with that. A lot of frustration because patients get relief for a period of time, and then their doctor says, well, you can only be on this medication for 2 years, and then we have to stop it because it's so dangerous. I mean, it can cause problems with liver and other issues. And now here we are stuck between a rock and a hard place of dealing with a symptom management, and then, having to make decisions about how long to poison our bodies, basically, for lack of better conversation. And so if you start going back again to where's the source and why is our body doing what we're doing, all autoimmunity and all inflammation comes from the gut. It comes from, what your body's trying to fight and what it's been exposed to over the years. And it might take 20, 30 years. People say, well, I wasn't allergic to these foods before. Why is it happening to me now? And it's just this buildup over time. If you take think about furniture, you got a piece of wood that you've put multiple layers, you've sanded it down and you're putting layers and paint and things, a protective coating so that it doesn't get damaged if you put a glass on it, right? Or something like that. So if you sat there and just rubbed that piece of wood every day for 20 years, at some point in time, you're going to get the layers gone. You're going to get down to the raw wood that's now exposed to the environment. If you get water on it, it's going to get damaged, right? So your gut's got lots of layers and they get damaged over time. So the sooner that we can start to recognize where that's coming from and start to make some changes there, that's where we really see some great results.
I want to learn more about your book because I would imagine you talk a lot about what we're talking about in your book.
Yeah.
And you mentioned probiotics. What should somebody look for in a probiotic? Something that you're taking every day. Yeah.
That's a great question because it is another area where it's just overwhelming. I mean, if you just Google probiotics, you're going to get 8 billion answers. So it's even for me, I mean, it can be overwhelming sometimes to, hone in. I think I probably have 8 or 9 different types of antibiotics in my practice. So, there's different ones for different things. But for somebody that's just kind of looking and saying, hey, I want to start doing something that's going to be helpful. One of the things that we like to look for is that it's got a mixed amount of flora. So you don't even have to know what the names are, but some common names is like acidophilus, lactobacillus, bifidobacterium. We can get into all the fancy words, and you don't even have to memorize that. But what you want to look for is, if you look at the ingredients, you want to see that there are several different kinds in there, because we want a mixture. There are some places where one type of probiotic is good for certain conditions, but for the most part, you want to have a mixture. So that's a good place to start, is, just look at the back of and you should be able to see, a list of the ingredients. And if it's a good quality product, they actually they can genetically test them. They're not genetically modified, but they can actually get a code, if you want to call it, for different types of bacteria. And there's a lot of studies that say this particular one is good for this and that. So good quality probiotics are going to show, like, it'll say bifidobacterium, and then it'll have a number next to it. And so that tells you that they're actually paying attention and sourcing it from a good quality bacteria. So that's something that you can look for as well. And then the second part is how much, and it's actually measured in billions. And so you have a 10 billion and a 30 billion, and it goes on from there. So when I first started practicing and dealing with probiotics, 10 billion was kind of the norm. That would be like the daily amount that you would take, but we found that to be really inadequate. And I don't know, again, if that's because we're killing them all off with all of our antibacterial hand sanitizers and soap. So, a little nugget there is you don't need all of that. If you just, regular soap and warm water is going to kill almost everything. So try to use that and if you can. Anyway, so 10 billion is really not quite enough. And that's often what you're going to see in just over the counter. If you go to the, pharmacy or something like that, you'll see a 10 billion. So to me, 30 or 50 billion is really the best from a daily perspective. And then if you're dealing with some sort of gut issue, or you're going to go on antibiotics for some reason, we may go up into 100 billion. And one of the products I have is actually 350 billion. It's in packets that you drink every other day. And we might do that for a month or two when somebody's got really severe gut stuff going on, or, some kind of infection that we're trying to manage. So, again, it can be overwhelming. There's a big spectrum, but, if you're going to go online, or going to look, go to a health food store or a vitamin store, then look for something in the 30 to 50 billion range, and one that's got at least 5, preferably 10 different types. It's a good place to start.
5 to 10 different types of bacteria, and cumulative of all those bacteria would be around 50 billion.
Right.
Okay. Just want to make sure I'm tracking, because I've got, I don't know, probably 4 or 5 different probiotics.
Yeah, bottles
like,
we accumulate over time.
Yeah, well,
And if one, maybe one is
effective?
10, or one is 10 or 20 or something like that, or it's only got a couple, to use them up. They're not going to go bad. You don't have to waste them, just mix them together.
All right. Yeah, no, that's good advice, because I'm like, oh, well, this one's just this one, and this,
Yeah.
I've never actually had a conversation about probiotics with a doctor. I just, read some stuff, and like,
That's because most doctors don't talk about them.
Yeah.
Unfortunately.
Well, what inspired you to write your book?
I think it's been in my head for quite some time. I have these conversations with people. One of the things that I do in my practice that I think is so valuable when I change the model of how I practice is spending time with patients. So I very rarely have an appointment that's less than an hour, unless you're coming in for like some, a quick visit or something like that. But most of my regular appointments with my patients are an hour long. So we have this kind of time to be able to spend discussing and talking about what their issues are, what's going on, getting those objective tests and helping people to understand. I think, really the true definition of doctor, coming from the Latin terminology, is teacher. So our goal is not to, dictate and just prescribe and say, you shall do this, but it's actually to help people to understand why is your body doing this? Just this conversation we're having. Now we understand more about why autoimmunity is there and why we're so focused on the gut, even if you don't really have any gut related symptoms, right? So I think that helping people to understand the why is really kind of what my whole goal is, and why I'm even doing podcasts and things like that, and why I do speaking events and getting on TV and being a guest expert on TV, is because I want to share that message. And it may not be, we're getting into some, medical details, but I don't always have time for that on some of my other events, but it's letting people know that there's a different way to do things. So my point with all that is I spend, hours with patients in my office, and so many times they're like, after I finish explaining something like what we just did, they're like, man, you've got a lot of knowledge. You should write a book. You should put that in a book, And so I've been hearing that for several years, put this in a book. And I will tell you that I was very good at math and chemistry and science, and I hated English. So if I had to write a paper, it was like, oh, nail scratching. I used to trade my sister. I'll do your math homework if you write my paper for me, when I was in like high school. And so writing is like awful. And I'm like, well, if somebody would just record me while I was talking, that would be super easy, because, I say these things and it's really easy for me to talk about it. But if you're like, start typing it anyway, I think I just got to the point where I felt, more compelled over the last couple of years to get this message out, to what I do, and sort of to help people understand that there's a different way to do medicine. So, I say to my patients, just like I talked about that, I finish a conversation, I say, okay, so here's what my recommendation is, especially if we're talking about hormones. Hormones is kind of, again, where I started. That's my niche, where a lot of my patients come from. And so I'm giving them what their hormone imbalances are and what my recommendation is. We're going to start this, and whether they ask or I basically say, I was taught in medical school to whenever I was going to prescribe a medication to somebody, that I would have to list all the side effects that they would expect, right? Or patients often are advised that, always ask your doctor what side effects to expect, or ask the pharmacist if you're going to, pick up your prescription and talk about it. And so I say, well, what we're doing again is we know what your levels are now. We know where we want them to be. We're prescribing something that is bioidentical, which means it's the chemical structure of this hormone cream, which is typical of what I'm going to use, is the exact same chemical structure as the hormones that are supposed to be in your body. And if we get them to normal levels, then normal doesn't have side effects. So we don't have to have that conversation about what are you going to expect. And I say, again, one of the great things about the way that I practice and how I've created my business is that we are readily available. So if something doesn't feel normal, then you call and you say, I'm feeling this. And it's my job, or my staff who's been trained by me, to decide, is that something we need to do something about? Where is that coming from? And so the patient gets to relax and just be able to live their life and not worry about what side effect am I getting. If I sit there and tell you this long list of side effects that you may or may not have from this medication, you already have a negative energy about that substance, whatever it might be, even if it's good for you, right? So you're getting ready to take this and you go, oh, I wonder if I'm going to have nausea today, or if it's going to cause me a headache, or is this, am I going to get breast cancer from, this pill? And then already that, there's a negative connotation to it. So you can get into woohoo, energy medicine or whatever. But I think, all that good energy needs to come into it as well, so that your body's accepting what we're doing. So that's really what started that. Is I'm like, I think that's going to be the name of my book, because I say it 50 times a day. It feels like, normal doesn't have side effects, and we're getting you back to normal, and you're going to feel amazing. And when everything's normal, then it's all working right. We're not fighting. We're not, your body's not trying to survive all the time. It's actually allowed to live. So we're not in survival mode, getting through day to day. We're actually thriving, and we're doing all the amazing things that we want to be doing. And that's really what inspired me to actually put pen to paper. Although I didn't write it, I recorded it. So smart thing, if you want to write a book, is just, pick up your darn phone. You got a voice recorder right there, and just start telling your stories and talking about what you do, just like what we're doing right now. And then all of a sudden it's a book that's on, on Amazon. So it's pretty cool.
Now, before we go, I I got to hear you tell the story, and it's an amazing story. Uh, so before we go, I want to touch on a few other things, but I don't want to forget to ask you to tell the story of delivering your own daughter.
Best story ever, right?
Yeah.
Um, so I told you about how much I loved babies, right? And I delivered 1,000 babies or I don't even know. We were talking about it the other day. I need to actually count it, but I know it was over 1,000 babies when I finished delivering. And there was one delivery that I would say was the crowning moment of my career, was
No,
delivering
no
my
pun
own baby.
intended.
So no pun intended, right? She's crowning. She never crowned. She just came out. That's the story, right? So I didn't get to have that experience. It's time. This is baby number 4. And if you're in the baby delivering world, or if you're not, usually the first one maybe, is a little bit harder to come out, and the others sort of pave the way. So by number 4, they're kind of, there's not much barrier there. But first baby, like I said, I grew up in Colorado. It was kind of granola, if you want to call it that. So I was like, I'm doing this with no medications, and that was fine. I'm not saying it was a horrible experience, but second baby, same thing. I was in residency, so I had a doula at the time, and I was delivering at the hospital while I was working, and so I had a doula there that was telling me to breathe and all that stuff. And I just remember it being the worst experience ever. And so by baby number 3, I'm like, I think I'm going to try this pain medicine thing. I've been delivering babies for a long time, and these ones seem to be going pretty well, and we don't have to have all the pain and the screaming and whatnot. But she came really fast. So my water broke. I got to the hospital, get me that epidural. Literally, I laid down after getting this, shot in my back, and they were like, okay, time to push. So the epidural really never took effect. So again, baby number 3, felt it all. So here comes baby number 4. And I had to be induced. I was, working hard. I had 3 other babies at home, and my blood pressure was starting to go up a little bit. And I was 38 weeks. So it was kind of like, let's just not mess around anymore. So it's, come in tomorrow, and we're start induction. So I got to the hospital about 7 in the morning. And start the whole process. You get Pitocin, we go into all these details. So, pretty darn quick, I was like, okay, let's make sure that anesthesiologist is close by, and let's get the epidural right away. So I have the epidural probably, I don't know, 8 or so in the morning, and I'm just chilling. I'm like laid in the bed. I got my family there. We're all just hanging out. We're laughing, we're giggling, everything's fine. And the nurse came in to check on me, and she said, this baby is just moving all over the place. So when you're in labor, if you've never experienced that before, they have these little like Doppler monitors that they kind of strap around your belly so that they can watch the baby's heartbeat. And then they have 2. They have one to watch the heartbeat and one to watch the intensity of contraction. So you can literally look at the screen and see this wave of your contractions. I couldn't feel anything, but I could see that I was having contractions and things were happening. So she came in, she said, the baby's moving all over the place, and we really can't keep her on the monitor, and we want to be able to watch it from out at the nurse's station. So how do you feel about us putting on an internal monitor, which is just a little tiny probe that they put on the baby's head from the inside? And I said, no worries. I've done that 100 times or thousands of times. I don't even know, in my career. So I knew that it was safe and it was easy. And she said, okay. And so she got another nurse to come in and help her out. And again, I can't feel anything. I can't move anything from, basically belly button down. So I'm laying in the bed. She's over on my left side, and she picks up my leg and moves it over to the left. And then the other nurse on the right-hand side picks up my leg and moves it over to the right, and boom, there's the baby, comes right out on the bed. And so they're all, I don't even know what they did, because I just immediately went into doctor mode. I reached down, I picked her up. I had a white hospital gown on, so I just start wiping her off. She's kind of got that, gooey kind of blood tinged slime all over her. And she's not really getting that good breath, that good cry that you want to hear. So I'm like, I need the suction. I need to get this stuff out of her mouth. And so they're handing me the suction bowl. I'm sucking her, I'm holding her right here on my chest, and I'm sucking her mouth out. And she's still really not quite getting that breath. She wasn't, blue and limp or anything like that. She just wasn't really, getting that good cry. And so I said, we got to cut the cord. And they handed me the clamps and I clamped her cord, and they handed me the scissors and I cut her cord. And then I handed my baby over to the nurse and said, here, take her over to the warmer. And within seconds, you heard that beautiful sound that you want to hear. That's your baby screaming for the first time. So I know she was happy and healthy. And they handed me this, little pink burrito bundle back about 5 minutes later. But it was an interesting experience for sure to just do it yourself, because that's what you do.
Oh, that's awesome. How old is your youngest daughter now?
She's 12.
And how old is your oldest daughter?
21. So I have 12, 14, 18, 21.
And I ask this question a lot, and what it kind of translates to is the most important lessons that you want to pass on to your children. And I started off by asking, there's typically what I find with the people that I interview, all of them have really gone through like these 3 phases where early life, they learn these important lessons through their adolescence. They move on into their young adult years, go away to college, begin their career. They learn some lessons, some valuable lessons, maybe through failure or some tough experiences, life lessons, and then move on into the later part of their professional life where they're able to digest all those earlier lessons and kind of distill them into, all right, this is what it's all about, and start giving back. And what I'm wondering is, like, you've had such an incredible career and touched so many lives. What are those lessons that maybe you haven't shared with your clients in your medical practice, but maybe some of those lessons that you want to pass on to your daughters, and really what you want to see them I don't know, manifest through following your example?
Yeah. I think there's 2 messages that come to mind. And it's not always been easy. I have these 4 amazing kids. The first one was born in 3rd year of medical school and then residency. So, I'm in the middle of trying to build this career and then have a family at the same time. And so, one message that I would definitely say is that, you got to work hard. When I got to meet Ice-T and Coco at one of my speaking events, and Ice-T saying, if you go out on this yacht and, all the people are upstairs and they're drinking, and where do you think the owner of that yacht is? He's down in the basement, he's down in the underneath the boat doing business, right? You got to work hard. And but you want to find a balance where you're not working hard, but if you put your mind to something. A lot of my kids play sports, and we've had the struggles of being on a team, and you may not be one of the starters, and they're like, I think I'm good enough to start, and I'm not their coach. I'm not going to make those decisions, but I say, well, you need to find out what you need to do to be that starter if that's really what your goal is, right? So ask questions, practice more, work hard. And I think that's what I hope that I have shown them. And when I have an internship program in my office. So I know we're asking about my daughters, but I do that because I want most of them are female, although that's not a requirement, but it just happens to be the way. We're in a college town in Clemson, South Carolina. So college students who are interested in going into medicine, they come into my practice and they do shadowing, or they do an internship. And part of the reason I do that is, one, because I want them to know that functional medicine exists. So when they go out into their world, that they might be able to incorporate that into their practice. But two, I think for young females, there is the tough balance. Can I have a family and have this career, especially in something like medicine? Is it really doable? And or people tell me all the time, how do you do it? I'm like, I don't know. How do you not do it? You just wake up every morning and you do what you're supposed to do, and you get it done. So I don't know, did I plan to have 4 babies? I don't know. I didn't really plan it. It just here's where it is. And now, I'm a successful doctor, I have a career, and I have these great kids. And so you've got to just persevere and you've got to work hard, and there's going to be obstacles in your way. And the best ability that you can have to minimize those obstacles as much as you can. So, my life has not been easy. It's been a struggle. I was married to their dad for 18 years, and he was a Irish Catholic alcoholic, and it was hard. We had a lot of down moments. And some of those stories are in my book, because I think you got to tell those stories. You got to be real and let people know, I'm not perfect, and I've gone through those struggles too. And if patients read these stories, and they can relate to me, and they can go, oh, like she went through these struggles and these issues, and, she appears to be doing okay now. So, I want people to know, and that's kind of where I connected with your story. You've had a lot of struggles and stress in your life, and here you are trying to get that message out that you can persevere through that. And so it took me a long time to make a decision to leave that marriage, because I thought, you got 4 kids, you got to stay together for the kids. And what I really found towards the end of that marriage is that, and you hear this all the time, I mean, we tried, we went to counseling, he went to counseling, all kinds of stuff, but really I was not able to be the person I needed to be for my kids, because I was in such a stressful environment at home. And my kids have struggled through that. My 14-year-old, well, she's 18 now, but there's another story in my book that when she was 14, she was hospitalized for cutting and suicidal ideation. And, that was right during the time where we were talking about divorce. We weren't there yet, but that was a big struggle. And that was an eye-opening moment for me to say, I have got to get myself in a place where I can take care of them. So one of my best favorite quotes I use all the time is from Hal Elrod, who's the author of The Miracle Morning. And I got to meet him at Carnegie Hall backstage. We were both getting ready to go on stage. And in one of his messages, he says, you owe it to those you love to be at the best potential that you can be, so that you can help them be at the best potential that they can be. So, it's one of those things, you're flying in an airplane, right? And they tell you got to put your own mask on first, before you try to help your young child or somebody who needs help. And if you don't take care of you, then you're not going to be in any kind of position to take care of anybody else. And that's really, for me, I would say over the last even 2 years, but 5 years, that has been really a focus for me, is taking care of me and my kid. It's really hard for moms to do that, because we feel very selfish if we're taking time to exercise or just take time away, that we're taking away from our children and the focus that we need to have on them. But your time is not quality if you're doing that. If you're stressed out and spread out all over the place, then you're not going to be there for them. And so, you've got to take care of you, whatever that means, and there's all kinds of ways to do that. And we can have a whole another hour-long conversation about that. But that's my favorite quote. You owe it to those you love to be at the best potential that you can be, so that you can help them be at your best potential. And that's what I do for myself. And I hope that that's what I'm sharing, that message for them.
We covered a lot of ground here. What would you say the big takeaway from this conversation is, aside from what you just said, because that was pretty ending. Yeah, no. Yeah, that's pretty powerful. But we covered a lot of health centric topics here: inflammation, hormone replacement, I guess maybe the biggest thing you would recommend is the testing, so that I maybe find a functional medicine doctor.
That's what I was going to say is, my passion right now is to get the message out that there's another way, and so starting to learn the words, functional medicine, integrative medicine, there's other way, holistic, whatnot, but, there can be a lot of different ways to name it. But, if you're in a place, whether you're having symptoms or whether you're just thinking about, hey, is my body in the best place that it can be? Is it in the best potential? So we're either fighting a symptom or a disease or a, diagnosis, or I'm on 8 different pills, or, I think I'm pretty healthy, but I want to make sure that I'm doing everything right so that nothing surprises me. Do a Google search, start looking for, is there integrative or functional medicine in your area? Find me if you're close by. We can do virtual stuff. Can't always write prescriptions over state lines, but we can at least have the conversation and get some knowledge out there. So again, going back to the more knowledge you have, and there's so much knowledge out there to Google, inflammation, and it can be overwhelming. Or we're talking about probiotics, right? What do I take? So my message would be, number one, that there's another way to do things, and two, start finding somebody in your area that can help you. We can't do it by ourselves. Everybody's got to have a mentor. Everybody's got to have a coach. In your fireman days, you had a hierarchy, right? You come in, you got to have somebody above you that's been there before, that trains you. Why do we expect people to be able to take care of themselves and their health with, just reading a book like that? You didn't learn how to fight fires reading a book, right? You can't be an expert in taking care of you and your health without having somebody who's done it before, or somebody who has the knowledge that's going to help you out. So it's an investment in your life. It's an investment in your health. And it's not just a cost to take care of your, sickness. So get out there and find the information, find somebody that can help support you, whether it's a functional medicine doctor, a health coach. There's a lot of smart people out there. And if it's me, I'm more than happy to be that person for you. But if not, just get yourself healthy and get the knowledge that you need to make sure you know what you're doing.
The best way to connect with you, would that be to go to your website or social media? What's the
Social
best way?
media, I'm posting daily, even more daily sometimes. Facebook, it all connects together. Facebook, Instagram, TikTok. I've been doing TikToks now. Those are kind of fun. Yeah, so social media is going to get you, information and details, and there's always links in those to my website. So I have my personal website is aimeeduffymd.com. Lots of information about me, my speaking, my book link is on there. And then there are links there to go to my office website. So if you're more interested in, patient interaction and things like that, carolinaintegrativemedicine.com is our office. And there's links there to learn more about my practice and how you can get connected. We do free discovery calls. So you just schedule a free discovery call and you get on a phone call with one of my staff, and we kind of learn more about you, what's going on, what are your goals, what do you need from us? And then we develop a plan for you and the next step.
And we talked a lot about women's health, but you do help men as well, correct?
Absolutely. Yep.
Yeah.
Yeah.
Awesome.
Men have hormones and inflammation and gut health and heart health and all kinds of stuff too. So yep, same thing.
Yeah. Well, thank you so much, Aimee, for allowing me to have this conversation with you and sharing so much valuable information. And I will have links to your websites in the show notes so that people can connect with you on social media, find your book. Yeah, I would encourage everybody, if you take nothing else, just Normal doesn't have side effects. Normal doesn't have side effects. That's the name of her #1 best-selling book. It's an international bestseller. Check it out. You got to get it.
Awesome. Thanks, David. I enjoyed it.
Me too. Thank you. Thank you for listening to this episode of From Embers to Excellence. Please like and subscribe to my YouTube channel. Follow me on your favorite podcast platform and visit hollenbachleadership.com for additional content. My goal is and always will be to add value to as many people as possible. So if I can be of any assistance to you or someone you know, please connect with me via email or on one of my social media accounts, linked on the homepage of my website. Remember, our failures don't define us unless we let them, and the only true measure of a leader is the success of their team.